Good evening, everybody. Apologize for the delay. We're having some technical issues with the chair right now. We're trying to sort it out. Thank you.
Thank you.
WITN, can you hear me now?
Yes, we can hear you.
Okay. All right, thank you. I'm switching laptops. All right, sorry about that, everyone. So welcome to our Health, Aging, and Disabilities Committee meeting. We have 2 agenda items on the agenda for this evening. And we will start with introducing our council members that are on the line. I know I have Vice Chair Cabrera.
Good evening.
All right. I also see Councilwoman McCoy.
Yes, hello. Thank you.
And our Council President.
Here.
All right. And again, Rashima Dixon at large, I am the chair of this committee. And we will jump right into our first agenda item, which is a resolution to establish a health aging subcommittee that will go along with that will report to the Health, Aging, and Disabilities Committee. The resolution that's being presented to establish the committee. One is that it was brought to my attention by one of our residents that we wanted to make sure that seniors were really at the forefront of the work that we're doing. And actually, Ms. Denise, and I think that she's on now. She's the one who had asked about what are we doing around seniors and how can we be more supportive. So this is really to establish a subcommittee to make sure that need is met. This will be a task force for citizens, senior citizens that are 65 and up, 62 and up. This committee will be developed to be the empower, direct, and also connect senior serving organizations in Wilmington. The Health, Aging, and Disability, the Health, Aging, and Subcommittee will now be established as a subcommittee under the Health, Aging, and Disabilities Committee. The committee will also be have composed of residents from Wilmington. It will also be Wilmington-based senior serving organizations, agencies, issue area experts who have demonstrated interest or expertise in promoting opportunity, services, equity, and inclusion for senior citizens within the city limits. We also wanted to make sure that the committee had established more so a structure to it. So the committee will have 11 commission members, as well as it will be designated to have 2 co-chairs for it. They will meet monthly, in addition to additional meetings that they want to have. But they have to make sure that they fit to the FOIA guidelines. The duties of the subcommittee will be to make policy recommendations, identify the seniors, the needs of seniors, and whether those needs are fulfilled by existing initiatives that are happening, or it can be helping out with making sure that we recommend nominees also to the Wilmington Health Planning Council. The subcommittee shall report its work and findings and recommendations to the Health, Aging, and Disabilities Committee on a quarterly basis. And the subcommittee's first report will be due to the Health, Aging, and Disabilities Committee within 180 days of its appointment. The subcommittee will be responsible for FOIA requests and any other creating and submitting minutes, reports as well, and making sure they are fitting the requirement for FOIA by making sure it's a public committee that is serving in that capacity. So again, this is a subcommittee that will be underneath this committee for the Health, Aging, and Disabilities, again, to make sure that we're fulfilling a need for our seniors here in the city. And I do want to recognize that Councilwoman Oliver has joined us as well. Any questions in regards to the Healthy Aging Subcommittee?
Yes, I do. I think this is a really good idea. I mean, I remember the other subcommittee, you were able to get some things done. Anything that is put in place to help our seniors, I'm in favor of. Anything put in place to help the constituents of the city of Wilmington, just far as enhancement, especially as far as health, because in our community has been a big health disparity throughout the nation. So if we want to, I think what you're saying is to try to gather some information, maybe in various areas to help out all seniors though. I just was going to say, I think this is a real good thing, and I would like to participate in the subcommittee, even being on one, just be very actively involved. Whatever you need me to do, I'm very much interested. I don't know if I'd be able to make every meeting because we do have a lot of meetings going on as it is, but I will be participating. So please put me on board. Thank you.
Thank you, Councilwoman Oliver. And I did want to recognize that Councilwoman Darby has joined us as well. Any other questions or comments in regards to the Healthy Aging Subcommittee? Any questions from the public in regards to the Healthy Aging Subcommittee? All right, I don't see any hands raised. Councilwoman McCoy.
Thank you, Madam Chair. I'm sorry, I may have blacked out there for a minute. Just wanted to make sure that all those who are actually part of the Standing Committee for Health and Aging are actually part of the subcommittee, or do we have to request to be part of it as well?
You would have to be right now request to be a part of it, only because we wanted to make sure the majority of it is the Wilmington residents.
I understand. Thank you.
Yep. Councilwoman Cabrera.
Yes, I just wanted to make sure that we talk about or have someone represented that can address maybe the issues of insurance. I find that working in the field that a lot of our seniors don't have the information that they need in order to make decisions on getting the best healthcare plans for them. And a lot of times they're not even utilizing all the benefits that they are entitled to, or can even qualify for plans that offer them additional benefits. So probably maybe just having someone, or that could be a presentation or something that's addressed, because equitable access to healthcare is also one of the issues that our seniors face. And just want to put that out there. That is something I run into all the time. And not only that, I don't want to say that they're being bamboozled, but sometimes I find that agents are selling them products that they don't need, that they can get the same services for free, or they're healthy enough that they don't need to pay for expensive plans for their health care, but they're made to believe that they need that. So there's some exploitation that goes on with seniors, and hopefully, you know, that is going to be one of the issues that we address in the committee. Thank you.
Yeah, thank you, Councilman Cabrera, and we can make sure that there's representation as one of the issue areas or one of the expertise areas that we can add into that committee. So thank you. Council President.
Yes, thank you. I just want to congratulate you and thank you for bringing this to fruition. You and Councilwoman McCoy really got a lot done when you had the subcommittee for community development. So I'm just looking forward to that same type of information that you'll be able to share with the community. Really interested in making sure that we pay attention to the seniors who are in the high rises. I just always hear horror stories about their living conditions and the treatment. I just want to make sure that that we definitely address those issues. And there are several high rises that are in the city. A lot of them just don't have the proper security. It's just a lot. I'm sure that you know what I'm talking about, but I definitely want to make sure that we address those issues also.
Yeah, and thank you, Council President. And that's I know that was some of the high priority that was given to me actually by not only the high rises, but even the homebound seniors that we have who are not able to get some of those services. And then especially around the healthcare component, especially during COVID, they didn't have some of those same opportunities to be able to be tested or also to get the vaccination. So some of that was also be added into the committee as well. So thank you. And to recognize Councilman Fields for joining us as well. And Councilman Fields, did you have something that you wanted to say, or you just wanted to make sure I noticed you were here?
Madam Chair, thank you for recognizing that I'm here, and that's all I have to say. Thank you.
Yep, thank you. Any other questions or comments in regards to the Healthy Aging Subcommittee? All right, seeing none. This is a resolution and does not have to be voted out of committee. So it will be on the agenda for June 3rd to be voted on by the full council. And with that, we'll move into our second item on our agenda, which is a presentation on the importance of lead testing for 2-year-olds. So can I have the individuals who will be presenting this evening to introduce yourselves?
Hi, yes. Thank you so much for having us this evening. My name is Sarah Buchich, and I am the co-chair of Lead Free Delaware.
Hi, thank you for having us. This is Amy Rowe. I'm the other co-chair of Lead Free Delaware, and we really appreciate the opportunity to explain the current situation and pending legislation to address it. Thank you.
Thank you both. Look forward to the presentation.
Great, thanks so much. Great, thank you. So we just introduced ourselves. My name is Sarah, and I've been working on this issue of lead poisoning for about going on 5 years now. I live on Philadelphia Pike, and there was a situation happening next to my house, and I started looking into issues around lead poisoning in Delaware, and it's kind of astonishing. So we're just going to go through tonight about the 2-year testing, but we welcome any and all questions. We are volunteers. Lead Free Delaware is a coalition of groups. We try to find other groups that are working on lead poisoning prevention and just try to work on people with common goals. Okay, if we could go to the next slide. Most of you probably already know about lead poisoning, but I'm just going to do just a quick overview. So there is no safe level of lead. It serves no purpose in the body. It doesn't do anything helpful, and it largely does everything harmful. There is no part of the body that it doesn't impact, but it mostly affects things like the brain. We know it leads to a lower IQ, lower test scores in children, poor performance in reading, science, and math. And there are also behavioral outcomes, reduced impulse control, behavioral problems in school, family, and society. And as you can see here, this is from the CDC. It's a systemic issue in the body once it's in, and it is irreversible. Go to the next slide. So a lot of times when I start talking about lead poisoning, people think it's over. Lots of people know it's not. The whole lead poisoning issue is very much still present in Delaware today. One of the things that has changed over time is we are seeing lower and lower lead levels. However, we've also developed over time knowing that at lower and lower levels, there are still effects. You know, back in the 70s when we, banned residential use of lead paint indoors and we took lead out of gasoline, we were seeing very high lead levels. And now we know that down to 3 micrograms, that impacts the grades and test scores of students. So we know, even though we're seeing lower and lower levels over time, we now know that you don't need to have a very high lead level to have side effects. So we really want to make sure that there's no exposure ideally, but as little exposure as possible. And as you can see from here, this is from the US Department of Health and Human Services. There are a lot of effects on grades and academics. So we really want to identify children early so that we can remove them from the source of lead and get them into early intervention services, which I'll go into a little bit. You could go to the next slide. So this is the current situation in Delaware. This is a map from 2019. So lead poisoning is seen all across the state, but obviously there's a very high concentration in Wilmington, as you can see by the reddish area at the top. This is why we are speaking tonight to the city of Wilmington. We really, that's very concerning. And while it's a statewide issue, that area is really concerning. Also, this map doesn't reflect all the children in Delaware. Another issue that we've identified is, and this is through public health's information, is that while we have a mandate to test all children at age 1, it's about less than 44% of kids who are actually getting tested. So we have less than half of the kids getting tested as required by the state law. There's a lot of reasons for that, which I will not go into right now. But it's a problem. So this map is a representation of the children that are getting tested. In addition, only a third of these cases will we see a case manager going to the home. So when children are tested for lead poisoning, if it's 5 or above, 5 to 10, public health usually sends some information to the home, sends some pamphlets, but a case manager does not come out to the home until the lead poisoning reaches 10 micrograms. So only a third of these cases have somebody coming out to their home, helping the family identify where the source is and potential ways to address that source. If you go to the next slide. So as I just stated, this is a problem because there are a lot of children who are not getting services. Now, this slide is a little bit outdated. Just this past month, we are very excited, the IDEA Part C, which is a service for children. So if children now test positive for lead poisoning and they're at 5 micrograms, they can now get early intervention services. So this is really exciting because up until 2017 in Delaware, you had to have a 40 micrograms which is extremely high. That is lead poisoning. It's an unreal level of lead poisoning. It's very high, and that's what was required to get like Head Start and things like that. In 2017, it was lowered to 10. And just last month now, if children test 5 or above, they can get into these early intervention services, which is really exciting because that's something that can help children. Even though lead poisoning itself is irreversible, we know the research shows that, if we get them into these early services, the brain is still developing and it can really benefit from early intervention services. So while it's not reversible, we can still get in there and help children. So if you could go to the next slide. So this is one of the reasons we've really been advocating for testing in Delaware. Not to mention that all the states around us pretty much do it at 1 and 2 years old. Maryland has done a great job at doing it. All the states around us really have a very robust testing system. Pennsylvania has a county testing system, so they don't have laws at the state level. But it's really something that in areas of the country where you have a lot of old housing that you see, 1 and 2 year testing, and Delaware does not have that. So the testing is really for, it's diagnostic. So this is the most reliable way we can find children who need help. As you saw on the first slide, you don't always know that a child has lead poisoning. They can have a lot of vague symptoms. It can present a lot of different ways. And the best way is to just do a lead test. And it's a very easy process. You just have a little finger stick monitor and just get a little drop of blood, and you can know right in the office if your pediatrician has one of those devices. So in the past, we've had these things in Delaware, these questionnaires. Questionnaires are not reliable. The American Academy of Pediatrics really doesn't recommend questionnaires anymore, not to mention that so many zip codes in Delaware are considered high risk that it's almost, it's not very useful to use a questionnaire. We also know that the testing at age 1, lots of kids aren't really moving around at age 1 as far as walking and putting things in their mouth. By age 2, that really changes. So some kids who are tested at age 1, by the time they're age 2, they're walking around, they're putting stuff in their mouth, and that's a really big age for detecting lead poisoning. And that's also an age where we can, if we can identify these children, we can get them into the IDEA Part C program. Also, as I said, because a caseworker will go to the home at 10 micrograms, if a child does have that, somebody will come out to the home and try to help the family identify where the lead is coming from. We do have an abatement program in Newcastle County right now. It's a limited number of homes, but there are programs like that that we would like people to get in touch with. So, to get their child away from that poisoning. And then, as I said earlier, we know if we can test them, we can get them into the IDEA Part C if they're eligible. You can go to the next slide. So there's so many sources of childhood lead exposure in Wilmington. Just in Delaware, we have a lot of old housing stock. We have a lot of homes from prior to 1978. So even though they banned it for indoor use, we know it's under a lot of layers sometimes. I personally live in a home from the 50s, so it's it's in there. We also know with older windows and things like that, the paint can chip off and create dust. As made more popular by recent events in Flint, there is lead in drinking water pipes. So, we want to keep that in mind, that lead, the solder, which is lead-based, wasn't stopped being used until 1986. So, if we're not using water frequently, it can sit in the pipes and can absorb lead into the water, and then it gets into our bodies. There's also a lot of issues with soil contamination, especially even if there's demolitions and things like that. We've found that, they can sometimes bring in soil, or there can be legacy industry issues where there's just old soil there that has not been remediated or taken off or contained, and that's an issue. Also, in more recent years, consumer products, toys, makeup, seasonings, it's been found in things like turmeric, candy, and all kinds of products around the house. And this is especially concerning with kids who are putting things in their mouth. And also, if you have a family member in a high-risk occupation, if you have a construction worker in your family, if you have somebody who works in the correctional system or law enforcement or works at a battery factory like we've had in Delaware, those are all places where you can bring lead dust on your shoes into your home. So, it's just another way that lead can get into our homes. So this is really exciting because there is a bill coming out. The representative is Larry Lambert of the Claymont area, and he's going to be the prime sponsor for the House of Representatives, and it's going to seek to expand universal testing for all kids at age 2. So right now in Delaware, we have the 1-year testing, which is mandated, and then children who receive federal services like Medicaid do receive the 2-year test, but this would expand that to all children at age 2. Because as we know, you just can't look at somebody and know if they have lead poisoning. So it's currently being circulated for co-sponsors. And this was also a recommendation of the Childhood Lead Poisoning Advisory Committee. There is a committee at the state that is tasked to look at lead poisoning. It had been meeting in the early 2000s, and then they had stopped meeting and they were restarted in 2019. And this was one of the things they looked at. And they looked at all the surrounding states and the data in Delaware. The committee is chaired by Dr. Jonathan Miller. He's a pediatrician. And so this committee recommended this in their report to the General Assembly. Go to the next slide. So the 2-year testing goals, like I said earlier, we want to identify kids who need help. We want to get the children away from the sources. Sometimes we can't always do abatement, but there are other things that can be done. And this would allow us to, provide those services or, get people in touch with ways that they can fix them. And then also if children are eligible, we can get them into early education during that critical time of brain development. And what's really key is we're already paying for this in so many other ways. People always look at it, it's going to be expensive, it's going to be this. We already are paying for it in the services that children require when they have lead poisoning and behavioral issues. So really the goal is to reduce reliance on those other services and, have a more proactive preventive approach so that kids can, get early services and start kindergarten with their peers in a general education class. Go to the next slide, thanks. And so we're really hoping that Wilmington City Council can support Representative Lambert's bill to expand universal testing to children at age 2. I want to thank Councilwoman Darby for inviting us to speak this evening. We really appreciate it, and we are more than happy to answer any questions if you have any.
Perfect. Thank you so much, Sarah, for the presentation. And yes, Councilwoman Darby is the individual who made sure that you all had your presentation today. But I do think and I actually, when you got to your last slide, I actually wrote that down, that we should do a resolution to support what Representative Lambert is doing in the General Assembly. So I think that's perfectly in line. I did have a quick question regarding, so if a student, for example, or a child doesn't realize that there's an issue with at 2, but they might have saw it at 3 or 4, could they still qualify for those same type of services?
Are you referring to the IDEA Part C?
Yes.
I don't believe that there was an age limit to that. Amy, you can weigh in, but my understanding of that was any child that is tested and is 5 or above was eligible for those services. So that wasn't just at age 2. That's okay. The way I understood that.
Yeah, that's correct. And I just want to emphasize that the current requirement that the state has is to test children at age 1, which is often too early to detect lead poisoning in homes because of the way kids behave inside the house and in the environment and sticking things in their mouths and crawling around on the floor or chewing on windowsills. Lead tastes sweet. So when you get to the point where you can lift up and chew, that's something, that 2 years can capture that. But I will say that the Childhood Lead Poisoning Prevention Act requires all students prior to their enrollment to have a lead test. So if they aren't tested at age 1 and we don't catch them at age 2, they have to have it before they enter kindergarten.
Gotcha. Okay, perfect. That's great. Thank you. Any other questions from council members in regards to the presentation?
I just want to mention, I believe we circulated a copy of the draft of the bill that's being currently circulated for co-sponsors when we sent in the presentation. So you should have that. And if you need a copy of that sent again, we can send it to you. It's a very nicely written bill with a lot of very clarifying whereas language that explains the current situation. And we're very pleased. I think right now we've got 14 co-sponsors. So hopefully by the end of the week, it'll be released early next week with a bill number.
Wonderful. Thank you for that information. Look for that. Any questions from the public in regards to the presentation? Mr. Farrell.
I'd like to thank you for giving me the opportunity and extending the opportunity to Amy and Sarah. The question, if it's going to be at 2, and say in a perfect world, we get everyone tested at 2, by the time they get in school, pre-K or first grade, at the age of 6, would there be a need to do additional testing, say at maybe 5 or 6 just to see? And is there a chance that if the numbers were low at 2 years old, that they could be higher at maybe 4, 5, or 6 years old?
Yeah, Don, thanks for the question. It's certainly possible. There are children who move. There are family members that change occupation and can bring lead on their clothes into the house. So there's certainly opportunities for the status of blood lead level to change as a child ages. And the scientific literature on this, Professor Bruce Lampier has written an article where he recommends that any child that exhibits behavioral problems in school should be tested for lead poisoning. So if you have a child acting up in school, they should get a blood lead test. And so that is certainly something to keep in mind, but it's certainly possible. There was a case in Lancaster County a few years ago where an entire family was hospitalized. They were a plain sect family, so either Amish or Mennonite or one of the plain sects. The entire family was hospitalized because the father was refinishing old chairs and he was bringing lead dust into the house. He was hugging his kids. He was, doing all the normal things, sitting on the couch, and then the dust gets on the couch and then people breathe the dust in or ingest the dust. And so in that situation, the mother, the father, and every child in the house had to be hospitalized to get the lead out of their body through a chemical process. So, there's a lot of things that can change in a household. And I think that continuing to look at how children should be tested for lead poisoning as they age, something to certainly keep in mind. The specific bill sponsored by Representative Lambert is to capture those kids at the critical age of age 2.
I have another question. Is there a need for women who are of childbearing age to maybe find out what their lead status is prior to conceiving?
There's been some discussion of that in the literature, and I believe that it is a recommendation of the Childhood Lead Poisoning Advisory Committee in their annual report that they submitted to the General Assembly in April to establish a work group to look at that question. Certainly, women who have a child can release from their bones lead that has been stored from very early exposure. For example, a woman was exposed to lead when she was 3 to 5 years old or something like that, stored the lead in their bones. Through the process of pregnancy, the fetus takes calcium, it releases lead at the same time, could expose a baby in utero to lead poisoning. A child could be born with lead poisoning. That is certainly a risk. There is not a formal discussion in Delaware on that topic. There are a few journal articles on the subject. I don't think that it's one that's received enough attention in the scientific literature, but that's something that I think could become a discussion point as we move forward.
Thank you. And I have a last question. You mentioned drinking water. Wilmington has the old lead service lines from the curb to the house. How much lead does that contribute to a resident?
It's really hard to say. I think that you would have to look at it based on behavior. Letting the lead contaminated water run before you drink is one of the recommendations that is made to reduce the likelihood that someone would get lead poisoning from those feeder lines. Other variables in the water, I mean, what we saw in Flint with the corrosiveness of the water prior to it entering those feeder lines impacted how people were exposed to lead. I don't have an answer to that question. I think it's one that should be investigated. We have a situation in Delaware where we really don't know a lot about the exact sources of lead poisoning. We have caseworkers from the Department of Public Health that visit every home with lead, an elevated blood lead level at 10 micrograms per deciliter and above. So for cases that are sort of like the high level of lead poisoning, we're sending somebody to the home. They're trying to determine the location of the source of lead so that it can be eliminated. For those children with 5 to 9 micrograms per deciliter, there's no investigation at all. There's no caseworker that goes to the home. There's no knowledge generated on whether it's water or lead paint or playground equipment or a parent who works at a firing range or battery factory. There's no information at all. So, that's a question that I would like to see more emphasis made on in the future coming out of the Department of Public Health. I mean, a future initiative is going to it's going to have to be to get caseworkers to go out to even these lower levels of lead in blood, because we're seeing that it's affecting performance in school. And when it affects performance in school, it affects a child for their entire lives. You don't succeed in school, it's harder to succeed in life. So preventing lead poisoning is about giving people an opportunity to be productive members of society.
Thank you very much, Dr. Rowe.
Mm-hmm.
Thank you, Mr. Farrell, for all those great questions. Any other questions from either council members or from the public? All right. Seeing no further questions or comments, thank you again for the presentation today. I think I was sitting here kind of taking notes. I didn't know a lot of the information that you spoke to today, so that was really helpful knowledge, and I'm sure a lot of our viewers will be able to utilize this information as well for this important work that you all are doing. So thank you for your presentation today.
Thank you for the opportunity. Thanks.
Mm-hmm. With that is our last agenda item for this evening for our Health, Aging, and Disabilities Committee meeting. So I will entertain a motion to adjourn.
So move. Second.
All in favor?
Aye. Aye.
All right, opposed? All right. Thank you all for coming this evening, and we will see you next month at our Health, Aging, and Disabilities Committee meeting.
Good night.
Good night.